Mind? No, of course not.
Liz, there's an ulcerative colitis in 3 and this is a TIA. I'll tell you what, instead of spending all day on the phone, I'm going to see a punter. NHS shock, doctor sees patient. When you see the UC, I've just got to go to the loo.
Dr. Collin?
What?
I'm the on-call administrator.
Oh, hi, sorry, thanks for coming down. I've got one chap with a cord compression. Now that's an emergency because he could end up with permanent paralysis and incontinence. I've not been able to get him on any neurosurgical unit anywhere. The other guy's had a heart attack and I can't get him a place on CCU, so that means I can't give him streptokinase, which will significantly improve his chances of survival. Excuse me, I've got to go to the loo.
I'll see what I can do.
Oh, thanks a lot.
So, where's the bed manager then?
She's on a course.
What, are they showing her mattresses and pillows and stuff like that so she'll know what her bed looks like?
Who do you think it'll be?
Look in the end bed.
I thought he was getting better.
Exactly.
The thing is, Andrew, I was hoping to pop out for later. Well, just for an hour. I've only just noticed my car tax as well. So I was going to get somebody to hold my bleed, and hopefully I'll be back before long. Dad bought it for me when I graduated. I wanted red, but he bought blue. Do you know who I feel like? The Red Queen. You know in The Wizard of Oz? No matter how fast we run, everything just seems to stand still. So, is it okay if I pop out then?
No.
What did I say?
Excuse me.
I can't budge your teeth. Sorry, Andrew, it's not an arrest. The student nurse found her comatose.
Let's have 50 mils of 50% glucose, please. Carolyn, forget the airway. She's going to need a dentist the way you're going on. Do a BM instead, with you. Liz, go back down to casualty to be more help there. Oh, and the Red Queen? Alice in Wonderland. Look, don't worry about it. I'd rather you put out a call and felt a bit silly than didn't and end up feeling a whole lot worse. She's been having problems controlling her diabetes. We admitted her so we could regulate her insulin injections. Looks like we overdid it a bit.
1 to 2 millimoles.
The overdosage of insulin has pushed the blood sugar right down, causing her to faint. So we replaced that sugar. And... hello, Kimberly. Right, let's start a bag of 5% Dex and check BM's half hourly. Okay, leave you to it. Have you,
Have you told your wife?
I couldn't. I told her I had a needle stick injury from a HIV patient.
You were supposed to tell her about us.
I know. Look, let's just get through the first problem, eh? And then we'll deal with the future.
The answer's no. I haven't been tested. And if I had, why should I tell you the result? Is certainly not to make things cosy between you and Alison.
I'm very sorry, Dr. Collin. Mr. Tennant told me I shouldn't be doing doctor's jobs for them.
Great.
He's got me projecting the hospital's car parking requirements for the coming year.
Well, it's not your fault, I suppose. Thanks anyway.
Andrew, casualty's chock-a-block. We'll have to move them out.
Okay.
We've got 10 minutes if you want to have your lunch.
No, I shouldn't risk it anyway with this stomach of mine.
Gorgeous stuff this is.
Is it?
You know, Mrs. Garden should have a go at cooking stuff like this. But she loses her sense of ambition every time she steps in the kitchen, that woman. Mind you, can't help having Kirk and Dirk. That's the twins, snapping round her ankles all day. Still, you've got all that to come with your missus, eh, Andrew? She's had her scan, Mrs. Garden. We've got another pair on the way, great, isn't it? Runs in her family, not mine. Her sisters, Maureen and Doreen, are supposed to be identical twins. Well, one of them is anyway, I don't know. Take my advice, Andrew. Don't get married, don't have children, and don't get caught.
What do you mean, don't get caught?
It's a joke.
Take it easy, slow.
There she goes, Mustafa. You'll have to throw water over him, lad, till he's returned to sea.
I see Ted Corbett's been transferred at last.
Yes, to cubicle 3.
And what about the MI and Resus, Mr. O'Neill?
Still here.
Get CCU to send down 1.5 million units of streptokinase.
But Andrew...
For what? Ted, how you feeling?
Oh, doctor.
Oh, you need a fresh bottle.
Oh, I didn't realise.
I'm just going to pinch one of your legs, okay? Tell me which one.
Ready when you are, doctor.
Right, I'm going to give you a catheter. That's a tube to go inside your bladder. Save you worrying about your waterworks.
There were two of them. Had a lunchtime session at the old Varsity Tavern. Minor cuts and
General, please.
Look, this is a casualty department and not a boxing ring. You get back in your cubicles, you behave, and the doctors will see you. Otherwise,
could you
it's
bleep
out
the
on your
neurosurgical
butties.
registrar, please? Pat, are you covered to do male catheters?
No, I'm sorry.
You get me a size 12 Foley catheter, Ted, please.
Hello?
Oh, yeah, it's Dr. Collin. I spoke to you this morning about a cord compression. Has one of our administrators been on to you about it?
No.
Surprise, surprise. Well, I'm getting really worried about this guy. I don't suppose...
I'm sorry.
Please?
Sorry.
OK.
Andrew, about the streptokinase.
What about it? Mr. O'Neill, I'm considering treating you here rather than at coronary care. Have a think about consenting. I'll be back in a couple of minutes, OK?
Right.
Oh, your TIA, I forgot all about it. Right,
Liz, I need you, Monica. Not that your name is Monica.
You dork.
Well, why don't you have a word with her for me?
Have a bit of work with her. Ask Andrew for it.
just the person.
The UC's fine.
Good. Can you do Ted's catheter? Thank you. Gotta go.
Andrew, may I have a word, please?
Certainly, yeah.
I'm afraid I've received a complaint from Dr. Curry regarding your telephone manner. The general practitioners rightly take exception to discourtesy from junior doctors.
Dr. Turner, I'm sorry to be such a pest, but there's so much work to catch up with on the wards.
You should have said, my dear. I'll walk with you. Canteen pulled out all the stops today, didn't they? Well, I'll be with you in a moment.
Here's your strep.
Thank you. Mr. O'Neill, what's your verdict?
Well, I don't suppose I have any choice. I'll just have to take my chances.
Good man.
Doctor, I wanted to ask you something personal.
Uh-huh.
Well, with me having had this heart attack, well, it's my wife. She's still a young woman.
All right.
Well, how long?
6 weeks. Okay?
Kids of a generation, I mean, international wrestling is a dream.
Forget your Thunderbirds and Captain Scars. The only true stars of the puppet firmament were the Pipkins. My name is Pig and I like chips.
I've started the strap on Mr. O'Neill, okay?
Oh, Andrew, I was wondering if you've got a minute, could I have a word with you?
What about Mr. Harris?
No, about Liz.
You want me to...
Put a word in for him.
Yeah, you know, something sort of like. What if you get the chance?
Yeah, sure, I'll pass her a note at playtime.
Hey?
Dr. Collin. And what about Hartley Hair?
I'm afraid I've had to reassign my colleague to her appropriate administrative duties.
Do we have a CCU bed?
No. And I was alarmed to find out, however, that you were considering treating the patient regardless.
What about a neurosurgical bed for my other patient?
Well, before I answer that question, Dr. Collin, I should remind you that this hospital has a
Yes or
strict...
no?
After a patient's death...
Yes or no?
No!
Andrew! Stop the strap. Blood pressure's 130/90.
Okay, can we nebulise 5 milligrams of salbutamol and have 200 milligrams of hydrocortisone IV? Did you get asthma, Mr. O'Neill?
No, never.
Okay, you've had a reaction to the streptokinase. It's not unusual. Is that the new ECG over there? Thanks. We're going to give you something to damp it down, all right? You've had a mild allergic reaction to a very important treatment. I recommend we continue the streptokinase along with anti-allergy treatment. We're going to keep a very close eye on you. Feel free to disagree.
I don't know.
Mr. O'Neill, I would like to continue this treatment. We can stop it at any time.
All right.
Good.
Could you look after Mr. O'Neill for us, please?
Okay, BP's pulse, respiratory rate, quarter hourly. Thank you.
Andrew. I don't mean to be funny, but do you think it's wise to press on?
Yes, as long as we keep a close watch on him.
The reaction could get worse. His blood pressure could crash and his ticker's already dodgy.
Charles Garden, is this patient in danger?
I'm just saying there's a risk, that's all.
Dr. Collin, since your management of this patient is already against guidelines, I consider it bloody worrying that you're being so cavalier.
I'm doing what I believe is best for the patient. Patrick, I accept your reservations, but we'll do as I say, please. If you have a problem with my judgment, take it up with my consultant. Patrick, can you get someone to do Ted's catheter, please? Thank you. Dr. Collin?
It's me.
Alison. Yeah, I'm sorry I didn't call you.
I'm really, really worried.
Look, there's not much I can do at the moment. The patient whose needle I cut myself on